inspire Uganda. Now today we get to talk about something very interesting for our parents in their old age, for people who need help, and something that is also in the line of Uganda's health system or health sector. Now Uganda's health system is composed of health services delivered to the public sector by private providers, traditional and complementary health practitioners. It also includes community-based healthcare and health promotion activities. In Uganda hospitals, family members are required to provide the care for patients. In hospitals, meals, washing, personal care, amongst so many other things. However, as time goes on, healthcare requires trained personnel for one to take care of patients, something that our guest, Mr. Nkore Barnabas, is going to talk about because he's a registered nurse, and we want to expound on this and even the impact of healthcare to our lovely parents, how to handle them. Can anyone just do this job? Is it really important? Does it actually help them survive or even stay longer? Does it help them with their emotions? A very good morning, sir.
Good morning, madam.
How are you?
Good, nice meeting you.
Thank you.
Sharon, I can thank you enough for what you do for our country.
Yes.
You've been educating the nation with so many values, and thank you. Keep it up.
Yes.
We love you and we watch you all over.
Thank you so much. Thanks for coming through. Now, tell us a little bit about our topic today. We're talking about the impact of health. Can you registered nurse? What is even this, you know?
So, you know, being a registered nurse is one of the best professions anyone can be, I would think. I've been a nurse for the last 18 years, and you know, we work hands-on with patients. I mean, a doctor comes, signs a prescription, get the medication, do inject, give medications, but we stay with patients, we stay with clients. And so being a nurse and observing different trends of care that on different ages of people, different acuities of patients. It has been a very rewarding career for me. We bring them in, the nurses help mothers give birth, and we take them out up to the end of life. We manage patients when they are dying. So through all that, it's the nurse that takes care of. We are the real servants when you talk about
Out of
care.
curiosity, you know, when we were growing up, they'll tell you, like, most of the men were doctors and women were nurses. So it was something that you always thought, actually, a woman is most likely to be a nurse and doctor. And I'm very glad to meet you, but I'm also thinking, how did you even decide to become, why did you decide to become a registered nurse or a nurse at that?
So that's a tough question. I'm actually, okay, I'll be honest. All my entire career life, education life, I wanted to become a priest, so, but I couldn't. So I'm a failed priest. So failing to take care of people's souls, I decided that maybe I could take care of people's physical health. And it has been a...
That sounds like a poem.
It's a phenomenal journey. And also the disparities out there, when they find a male nurse, they think you are a failed doctor. Yeah, they think we never made it to becoming a doctor, so we decided to become a nurse, or we are lazy doctors, we want it easy. But anyone can be a nurse, because a nurse is described as someone with a very big heart. Because what we do is what so many people can't do.
Interesting.
So, yep.
Yeah, we're talking about Vantage Home Healthcare, and you're the founder. Why did you decide to find this? Yes, you are a registered nurse, you love taking care of people's physical health and all. What drove you to make this, or to come up with the idea of the home healthcare?
So, thank you. So 22 years ago, I went to Kubacheyo in Boston.
Yeah.
And I have been working with the elderly, with the sick, people with developmental challenges, and also people with special needs. I became more interested into the career that I had to up my game, and took a degree course in nursing. So for the last 18 years, I've been a nurse, and taking care of the sick in different hospitals, in rehabilitation centers, in assisted livings, nursing homes, and I also actually am an expert in hospice. And that's where my heart falls, taking care of the dying. So I decided that maybe I could also be one of the owners of a business that promotes care into people's homes. So I started Vantage Care in the US. I ran a home care business. But the real dream came in when 3 years ago, my mother is 81 years old. My mother has diabetes, has cardiac issues, blood pressure. My mother forgets a lot. She would mix her medications. My mother, because of old age, her joints are painful, so her hygiene skills are very poor. She would only be at home 3 months, then frequent hospitalizations due to poor management of her long, non-communicable diseases. So one time she went to the hospital unconscious. She had a urinary tract infection, it went into kidneys, and she became uroseptic. We didn't know she was going to come back. So she came out very well. Wow. Now, me and my siblings, we decided that we need to instruct someone to manage my mother's care. So teaching a small little boy in the village, I come from Rukunjiri in the deep village of Gangari, and so this kid made sure that my mother's blood sugar levels were taken every morning, so she could take her medications. She made sure that her blood pressure was taken, and if it was off, they would call, so we notify the doctor. Made sure that my mother took a good shower, so she wouldn't smell, because with old age, they lose control of their urine. This kid made sure my mother's bed is made every day, made sure that her meals are in time, made sure that she takes the right medications as the doctor puts the orders in place, morning, afternoon, and at night. So for the last 3 years, my mother has not gone to the hospital.
And she's okay?
That's the real reason. My mother is one of the 2 million old people we have in Uganda today. And if my mother can benefit from these kinds of services, you don't need a degree, you don't need any six-level education. So why shouldn't other people benefit from these kinds of services? That's really the reason. My mother is the real reason I'm starting this in Uganda. And I think so many people will benefit from this.
Okay.
And if we can do it for Bazungu out there, why not bring it here also?
Yes. Why do you think we don't actually have such a system in Uganda? Because when you talk about Boston or abroad, it's something that they actually usually do. But for us, it's something that we're getting into, but many people are not even used to that, because my auntie will take care of me, my cousin can take care of me, perhaps we even have extended families, and it's not really, it's like a bit alien to Ugandans.
Yes, and this is my personal opinion. It's not research, but I've lived long enough to make my own judgment. So think, before the government came in place, our life expectancy was 47. And the good governance of the NRM regime brought numerous hospitalizations. There's a lot of sensitization on lifestyles. People exercise. There was marathon yesterday.
Yeah.
People eat a balanced diet. They boil water before they drink it. We have vaccinations. We have antibiotics. We have so much to benefit from. So people no longer die at 47. Our life expectancy has actually increased to 65 to 67. Now, my mother, I told you, my mother is 81 years old. People are living longer. So when they came in, there was this, it wasn't anticipated that we were going to live this long. So even in the curriculum of education, geriatric, which is old age study, is very minimized. It's not actually emphasized on. So they didn't plan for this group of people coming in, because we didn't know that we would grow this old. So that's why it's not really a big factor in Uganda, but it's coming up. Think, if we have 2 million old people in Uganda today, in the next 20 years, it's projected that Uganda's population is going to be 75 million people, and of whom 6 to 10 million people will be above 65 and above. So think, people are getting older, but growing older doesn't mean that they are aging healthy. Think after 50, that's when people start to get diabetes. Stroke is #1 cause of disability among the adults. People get blood pressure, people are becoming obese, people are growing with these sicknesses. And if you are 80, you have arthritis, if you have joints, your balance is going to be off. We have so many falls, injuries related to falls because old people fall. Confusion makes them unsafe at home.
Is that amnesia?
No.
Is that dementia?
Dementia is a new phenomenon. It's coming up. It's a question forgetting. So what happens with dementia is that protein builds around the brain. Oh, wow. And the brain is not able to function the way it would function, the way I'm functioning, you and me. Wow. And it's a very sad diagnosis. It's a very bad disease. To find that you have a parent that has raised you and they reach a point of forgetting their own children. Yes. And it's hard for children to think that this can happen. So it's a sad disease. But besides that, there's also like Parkinson's disease. We see cancers also on the rise. We see when people get old, they lose teeth. And so you find your loved one losing weight. We don't know that the gums hurt when they eat normal food. Yeah, so we find that this is a package of old age diseases that come to the old people. So they mix up. For example, my mother wouldn't understand, why am I taking medications? I'm okay, I am not sick. But we know that if she knows to take her medications, her blood pressure is going to be skyrocket. Her diabetes is going to be uncontrolled. And so we see these people going to the hospital when it's too late. And however, I told you, she's not gone to the hospital for the last 3 years because a small kid manages her non-communicable diseases. Someone
might be thinking, but we've lived through. We have a grandmother who is 89 years old.
Good for you.
Or someone out there is just thinking, but we have seen, we've taken care of people and they've been fine. Why think of home health care in the way that you think with that perspective?
Thank you. So there's nothing that beats being cared for in the comfort of your home. Okay. If you ever imagine what happens in those hospital rooms or general wards, I have visited a few hospitals here. I don't want to be sick in that kind of environment. And we see a mixture of the young acute care with non-communicable diseases and the kids more or less mixed up together in these general wards. It's not a good environment. So if we can manage a client or a patient at home, there's nothing that beats that. And actually, if they fall sick, if they are hospitalized and they transfer home, and we manage their sicknesses at home, we have a nurse who checks up vital signs, blood pressure, temperature, pulse, respirations. We know if the temperature persists, maybe the infection never went away. So we can call the doctor and say, you know, the temperature has persisted in above hundreds. And the doctor most likely is going to say, go to the pharmacy, pick this kind of antibiotics, start giving morning, evening, 4 or 5 days. We control an infection at home. So who doesn't want to be treated at home? I mean, so Vantage Care comes in to intervene, and the best benefit is that we are going to reduce the cost of hospitalizations that wouldn't happen. You know, we one-on-one. So we have a program that instructs people like the one takes care of my mother, how to manage patients like this or clients like my mother. And so being in the comfort of your home is the #1 benefit, especially for the old people. Think, you grew up in a home, you found your parents in this home, they are still there, we left, we were educated, we are out in the office at work. So it's, they don't want to leave the comfort of their home. Some say, I want to die home, don't take me to the hospital, because the hospitals are not the best places to be, especially when you're sick. Yeah.
But that's one of the points I pick up actually from the advantage of home healthcare and something that Vantage does. But then the doctors in the hospitals, and I might just have regular visits. Why choose? I understand home is very important, but so do you actually have training for the people that might do it for the people at home?
Yes, and what do we do? Vantage Care Limited is a program that instructs the young youth or young adults, so to say. So we bring these people up as 4 and above. I mean, this is not in any system of education or Ministry of Health, but we have put it on ourselves because it's going to be a great need. Especially we are going to provide employment for the youth, first of all, but also giving back to the parents of this country. I think that's a great value. It's going to happen to us if we start it. If we neglect it, we'll never be cared for. Old people out there are isolated, neglected, and abandoned. So besides the teaching or the instructions that we give these people, so we have a 4-week instructional class in class. And what do we teach these people? We teach in a simple, understandable language, instructional way. We teach core values, the art of caregiving. Think of dignity. When you talk of dignity, you're talking about respect, raising people's personal esteem. We are talking about taking care of people with compassion. Talk about privacy. We teach them the information you find in a home is confidential.
Is compassion a very big component to actually the well-being of like the elderly and people who need help?
Absolutely. If you don't have a heart that puts yourself in the feet of this patient and know that even if I have dementia and I'm confused and I've even, someone forgets to go to the bathroom and goes in the bathroom in his pants. So we want this person to feel cared for with a lot of respect and integrity. It's not about them, it's about them. It's not about us. We manage these cases with respect and integrity, and we want them to feel like part of the community. I mean, old people out there who wouldn't want to go to the wedding of their grandchildren. You cannot just pick a child from the village and say, I want you to accompany my grandmother to the wedding of my son, something like that. If you know that this person has been trained in safety, they are old, they're going to fall. You don't want an accident. And we know someone is trained to dress and undress someone very well. So we do grooming services. Someone comes in and takes that first snapshot. I think I can make this hair look good. I think maybe since he's going to the wedding, I will put some makeup on Grammy so she can be presentable if she's going to church. And if it's a gentleman, we do a shave, we do a haircut, we put on a white shirt and a necktie so you can be part of the community. If you've never had these services, these are the things you're bringing back. And I mean, they want to socialize, they want to feel part of the community.
They don't want to be isolated at home
and
the
abandoned.
whole time. Yes,
I mean, you find an old woman with nails that are dirty, but there's nothing wrong with having someone who knows how to cut the nails. You can even put, how do you call the
vanish, nail vanish?
The vanish.
Yes.
The vanish. They would be very proud. I mean, if you do their hair, if you dress them very well, put a necklace on them, and then if they can't walk, we actually also provide equipment. You know how to transfer them. Safe transfer from bed to chair, safe transfer from chair to the toilet, from toilet back to the chair, can wheel them into the church, they pray, and they feel like part of the community. So not only that, I mentioned dignity, we also teach them how to communicate to families. You and I are right here. If anything happens to my mother, I want someone to tell me, your mother didn't eat breakfast. What happened? What happened last night? Or she didn't sleep. Did she have Was the room too hot? Or was it too cold? Was there too much noise? Did she drink coffee? Or things that keep them awake. Those are the things we want to know before we establish that there's a real reason. So change in condition. Confusion among the elders may be a sign of urinary tract infection. If you touch her skin and she's warmer than normal, then you know it takes it calls for checking the temperature with the thermometer. We don't report, we report objective data. If she never used to get accidents, now she started to get accidents, then we know there's something going on. So we teach people, we teach our students, call them students, all these signs that make changes in the lives of the old people. We also teach them to make these people active. I mean, independence, just make small exercises. We call it range of motion, flex the joints, so that the circulation can go on in their system. So we pretty much service the whole integral body, and think if they're incontinent, they have accidents, we know how to put a diaper on. We know every 2 hours the diaper is most likely going to be wet, so we take them and change it. We can fix their meals. I mean, we take them, we bathe them, we dress them, maintaining skin integrity is one key, because if someone stays in one position in bed, it's most likely going to break their skin, because their skins are frail.
Wow.
And
so that's training.
Yeah.
Okay. So then, is there also a place where can someone hire someone from Vantage Healthcare to take care of?
Yes, and that's really the benefit and the feedback out there. We have been in Uganda for the last 1 year. We're struggling like any other new business, because culturally, it's not something that everybody is embracing. They think we can take care of our own, but it's going to be no more, because demographics show that young adults are a working group, and our parents are way in the village, so we're not going to be there. So someone has to be trained to do this, and we have provided care to several families. We teach these people in class for 4 weeks, and then we have partnered with Nakasero and Kampala Hospital. We take them for another 4 weeks for training, hands-on care. And they love it. And by the time they leave Nakasero, they are very well experienced. So out there in the community, families are very pleased, very, very pleased. We received numerous calls saying, we just called to say thank you. We didn't think this would happen to our parents. I know they say we can sleep knowing that our loved ones are in safe hands.
Yes. Wow, interesting. Thank you so much, Mr. Nkore. We'll just take a short commercial break and we'll be back with more. Still, we're talking about home health care, why it's important, and why training actually is very important as a component for the best home health care, something that Vantage Healthcare is doing.
Live from UBC Studios in Kampala, this is Good Morning Uganda Extra.
It's our mission to secure your money.
Protecting your money is as important as earning it. It is for this reason that the Deposit Protection Fund of Uganda, DPF, was established by the government of Uganda to provide deposit protection to customers of regulated financial institutions. In the unlikely event that your commercial bank, credit institution, or microfinance deposit-taking institution fails, the DPF will pay you up to 10 million Uganda shillings. Keep your personal information such as national identification number, mobile phone, or an alternative bank account updated with your banker. Terms and conditions apply. For more information, contact DPF at Aha Towers, Plot 7 Lodell Road, Kampala. Call 0312-206-400 or visit our website at www.dpf.or.ug.
We are the DPF. We protect your money. Protection Fund of Uganda.
The Tales of Kasozi, brought to you by Uganda Communications Commission.
Hello?
Hello?
This is Kasozi. How can I help you?
Hey, Kaso's my brother. Long time. We last met when we were at campus. It's been a while, but you are the person I'm looking for.
Campus? Really?
Hey, you don't remember me?
Okay, so how can I help you?
I'm stuck in Gulu making millions, and I need to urgently send money to my sick mother. But I can't find any mobile money agent near me. I've sent the money to your phone, as you can see the message. It might take a few minutes to come through, but I urgently need you to send the money to my mother. Let me send you her number, and you send it to her chap.
My friend, I'm afraid your mom is going to die.
What?
Because I don't know you, I never went to campus, and I'm also in Gulu. So can we meet at CPS, we talk about it?
Stay tuned for what Kasozi does next.
Tofera. Refrain from unnecessary engagements with strangers over the phone. This message is powered by the Uganda Communications Commission.
The Ministry of Health informs the public that there are confirmed cases of Ebola in Uganda. We, however, urge the public not to panic as the situation is being managed. The Ministry of Health further reminds the public to be on the lookout for any persons who may show signs and symptoms of Ebola. These include high body temperature, abdominal pains, diarrhea, vomiting, bleeding from the body openings such as the nose, eyes, and mouth. Please inform the nearest health worker immediately if you see anyone with these signs and symptoms. To prevent Ebola from spreading further, please take the following preventive measures: regular washing of hands with water and soap, avoid handshaking and hugging, avoiding any contact with any suspected Ebola patients. Any person who dies suddenly should not be buried but reported to the nearest health worker or LC1 immediately. For further information, please call the Ministry of Health toll-free number on 0800 100-066 or send a free SMS to your report on 8500. This message is from the Ministry of Health with support from UNICEF and World Health Organization.
Live from UBC Studios in Kampala, this is Good Morning Uganda Extra.
You're still watching Good Morning Uganda Extra with Ms. Sharon Chomdish and Mr. Nkore Barnabas, founder of Vantage Care Limited, Uganda. We were talking about some of the services that you provide. Who are usually the recipients for these services?
Thank you again.
For this care?
Yes, so our beneficiaries are the elderly, aging in place, our grandparents, these old, and we also have a category of the sick recovering from hospitalization. You notice people now, hospitals are so full that they can't wait for someone who feels better to stay for rehab, to get out of the hospital walking, managing their own lifestyle. So they are generally weak, and these people end up going to their in-laws or their families in and around the hospital, Kampala, before they get the energy to go back in the villages and be on their own. So those are the sick. Think about mothers who have given birth with a C-section and they are going home with a wound and they can't take care of themselves and the baby. So those are the people that we have benefited also. Like I said, they also, they are special needs people, people with disabilities. These people can't do anything for themselves. They can't feed themselves, they can't bathe, they can't use the bathroom. They need 24-hour care, and they need really to have dignified care. Then we have also the developmental challenged people, the people that have bodies that have grown but their brains can remain stunted. So these people, safety is key. They don't know whether they are next to the fire or they have a knife or what this means. So it can be bad if they injure themselves because they don't understand. The level of comprehension is very limited, and these are birth defects that some people are born with. So we have those categories of people, and like I said, the aging are going to be the majority in the next few years, because we have the benefit of living well today. Yeah, people no longer die young. Yeah.
Why is it more important right now to actually understand and have people trained for healthcare, like what Vantage is doing, compared to 5 years ago, 10 years ago? I know you talked about life expectancy, but why should we embrace it?
So, there's a lot of, like I said, with isolation, with abandonment, with neglect. I mean, people who have not gone through what we teach our minimal basic training, boys and girls, they have no concept of how to manage people who are sick. I mean, think about abuse. Our old people are being abused by people who have not trained that this is wrong. That a patient with dementia, if he slaps you or if misunderstands you or if doesn't eat food, it's the disease and not the human body you're seeing there. So we want them to feel, we want families to feel like, yeah, these people know that my mother gets confused and she may refuse food, but I have someone who will be patient with my mother and feed them along the way. She will finish the meal, instead of coming home and say, oh, my mother has lost weight. Because if it's a local person, say, yeah, she doesn't want to eat. We put food in front of her, she doesn't want to eat. If it's someone who has painful gums and the food is very, very hard, it hurts their gums, so they will not eat. We want people to understand that if you have someone in bed, someone with a stroke, bed-bound, bedridden, we need to be repositioned every 2 hours, maintain skin integrity. If there's a skin breakdown, then the wound is going to be infected, and these wounds end up killing them because they're infected. We train these skills of knowing that, okay, like we talked about the food texture of someone who has a stroke, someone with Parkinson's. It has to be this soft food, which is mechanical soft or puree foods, so they don't choke on these foods because they have lost their gag reflex. And it's the patience, it's the respect, it's the compassion we have we take care of with these people. So we have a syllabus that is very detailed. Someone with congestive heart failure, someone with a disease that has failed, if the heart is too weak to pump the blood, circulation is limited, and then we find the feet are swollen. We know those are high risk for injury. If there is skin open area in the legs, then that's going to keep oozing, and if it keeps wet, then bacteria finds a way of living there. And or we teach them, report that the feet were swollen this morning. How come? If she's a patient with cardiac issues or has kidney failure, then maybe the medications is not working. They communicate that. The doctor will understand that 20 milligrams of these medications is not enough. Let's maybe add 25, and see if there's more fluid retention. And if they urinate a lot and the feet are not swollen next day, then we know it worked, instead of bringing them to the hospital. Patients with diabetes, it's very critical that we manage these people with someone who understands the effects and how to manage diabetes. Clean the area where you're going to prick. Read their levels, signs and symptoms of low sugar, high blood sugars, and also knowing that people with diabetes are not supposed to eat these kinds of meals. Are they taking their medications? I mean, we go through all these kinds of diseases that are common in the communities, and we teach them how to manage them. Dementia patients, I mean, someone gets out of the house, they'll be lost. They don't know how to come back. We maintain them. Someone can't walk, we walk with them, side by side, ambulate with them, and we know they are safe holding them.
Yes. Is home healthcare different from nursing homes?
Absolutely. So nursing home or care homes, these are institutions where parents are sent to live. They are assured of 3 meals, a bed, a nurse or a doctor on the floor. It's like a hospital, but managing non-communicable diseases. Non-communicable diseases are these diseases that come with old age, the blood pressures, the diabetes. So, I'm paying a facility to contain my mother and lives there. It's like a mini hospital. But home care is different. And just mark that the future of healthcare is going to be home care. Just whether we accept it or not, that's where care is going. Because we cannot contain all these patients in hospitals. Look, COVID kept people at home, and people are dying of uncontrollable diabetes, careless diseases that we could have managed if we had someone who knew, because there are not enough services out there. So that's we manage your client. They may not even be sick, but you just want to have peace of mind that someone who's with my 89 years old grandmother will be safe. And so the comfort of staying home. I mean, people want even to die at home. They don't want to die in the hospitals. Hospitals have a lot of complications. People go to the hospital sick, they get more disease from there. They call them hospital-acquired infections. Because think, who is in the hospital? Bacteria everywhere, surfaces, everything like that. When you think of the ratio of nurse to patients in Uganda, it's 1,200 patients per one nurse in Uganda. Wow. Yes, World Health Organization reports that. When will the nurse reach out to someone who's crying out for help? It's cheaper to maintain this person at home. And dependability. You can depend on Vantage Care. You know, you may have someone at home, but if they have a sick child or they are away, we can always substitute the same services with a different person. So the continuity is very important.
What are the prices?
It depends. If you are, so once you call us, we have a registered nurse that comes and does assessment. Prices range from different complications. If you are bedridden, transfer is so heavy. We have to change your diaper every now and then. It's different from someone who we come in the home and maintain safety, give you companionship. So once you call us, we would discuss that.
Okay. You talked about hospice care. Please elaborate more about that.
So thank you very much. Hospice is my passion, and not until when the doctor determines that your prognosis is 6 months or less.
What do you mean prognosis, just for someone out there?
Yes, let me explain that. So the doctor will check on your disease and see that this is the disease that's going to kill you, terminal illness, and says you are going to live for the next 6 months or less. And so now hospice is highly recommended to manage a patient who has been determined that they are going to die in less than 6 months. So then we start to involve social workers, we involve chaplains, we involve family members, friends, relatives, healthcare proxies, everybody. It's a team of supportive care.
Do we have social workers in Uganda?
I believe so. We have a course in Makere of social. I don't know whether there is medical social workers.
Yes.
But if that is really their role, because that's when support is needed. And families do not understand the end of life process. So they also play a big part. Nurses play a big part in educating families and close friends. Of course, now nurses start to work with the doctors. We see this is happening. It's an expectation. Did you teach the family? Did you explain that this is happening? Is the patient in denial? Are they angry? Are they accepting eventually? So we take a tour towards the end of life with you, and we help families. We bridge that gap. We also educate families to accept eventually that, yes, this is where we're going, let's accept. But the key thing is comfort, dignity during this time. Yeah, because if they say you're going to die and you have reached the point where, yes, it's acceptable, why should someone have symptoms? Terminal agitation, for example, which is known to be caused by pain. Because pain, they are no longer talking and explaining where the pain is. So normally, pain causes anxiety, agitation, and it shouldn't be the case that anyone dying should die in pain. That's unacceptable. That's nothing like anyone should die in pain. No one deserves to die in pain. There's no reason why. And so we manage pain, we manage anxiety, we manage secretions that build up when someone is dying. We maintain skin integrity because they are incontinent. We take good care of you the way you take care. I'll take care of a dying person and you'll be amazed, like, yeah, I can give a kiss to a dying person because their skin is clean, their hair is done, they are in clean bed sheets, they are not oozing saliva because doctors know there's medication to dry mucous membranes, and there shouldn't be any smell because they lose urine, they lose feces. So we maintain that dignity of a human being up to the end. But mostly, no one should have pain at the end of life.
Does Vantage Uganda Limited do that?
We teach them, and we teach them signs and symptoms of discomfort. You know, we are not medical. We are non-medical, but we want families to understand that we will not be comfortable looking at someone who is mourning and groaning, crying out for help, and yet there's no help. Families need to intervene for their loved ones and call doctors and say, we cannot see this happen. I mean, there's a lot of stigma about pain medications in this country. It's, if someone is dying, yes, they are going to die anyways. We are all going to die, but no one should be denied a chance to die comfortable.
Have you ever worked on a person who is dying? Like?
So, I'm a hospice nurse.
Okay.
And that's where actually my current position is.
Tell me about your first experience.
With the dying?
Yes.
I have seen so many people die
that very
in my
first
hands.
day when they, oh God, but like the first day they told, the first day your first experience.
My first experience was on acute care unit in a hospital when someone, and this patient had a nasogastric feeding tube. He had an infection mass. It was cardiac failure. It was an old man, like 75. I remember I went in a room, the patient was non-conscious. I pushed the button red cord. I just jump on top of the bed, start resuscitating, and the doctor comes and says, so tell me about this patient. You are busy. You know, that's the funny part we have with doctors. They want to know when you are busy resuscitating a patient, and then wants you to continue multitasking when you're a nurse. This patient came in yesterday with the MRI, found that had a few strokes, but she had numerous strokes, has an infection, cannot eat, and urinary tract infection. So all these things come in. So as you're resuscitating, he wants you to start medications to revive the patient. Then another nurse comes and jumps over, you go pull the medications, and you start to push it. So eventually he died. And we pronounced him there. That was tough. I was sweating, and So, but besides that, I have seen, I don't know how many, when you're in hospice, and the reward is that you have reported to the doctor that I cannot see my patient with anxiety. I can't see mucus coming out. And can I increase the medications for anxiety? Yes. How much is he receiving? Receiving 5 milligrams of Ativan every 4 hours? No, I need 10 milligrams every 4 hours. The doctor says, go ahead. So we are there with them. We see pain. You first take, when you enter a room, take that first snapshot. For example, we have signs of pain that we read from a patient. If they are not able to communicate that they are in pain, we find a face wrinkled, that tells you that the patient is in pain. If you try to turn them and they don't want to go into more pain, because but you can reposition, take care of these people, bathe them in comfort. So you go see what's happening. Are they anxious? Are they agitated? Is the skin still intact? Is there any temperature? They necessarily get high temperature because their immune system is compromised. So they can't swallow medication to minimize the temperature. So we use the rectal. We put medications in the rectum, and the temperature goes down. This is real hands-on care when you're in hospice, because we don't want them to feel hot. We want them comfortable. It's amazing, but you will notice that the patient is at the end of life, and you'll be by the bedside, and the best memory you want to live with family members is the good memory of having taken care of their loved one with managing symptoms very well.
What is some of the feedback you've gotten from some of these family members that, you know, you sat down and you're like, oh, wow, yeah, I can't believe someone saw me do that, or they appreciate you?
They do appreciate, because, you know, you don't want your last memory of your loved one to be, oh, he was suffering, he was dirty, he was smelling, his eyes were popped out, he was naked, because no one controlled that, managed that. So when someone takes their last breath and you see a family member gives you a hug, you know, it is something priceless. And we do this on a routine basis if you're in hospital. In the US, there are 80 million baby boomers. Each day, 10,000 Americans retire. And so we are, yes, this is serious. We see death almost every day. Cardiac issues claim 1,000 lives in the US every day. Wow. And this is because of the lifestyle, you know. It's not going to change. Uganda is adopting the Western style of eating. You see a lot of fat. You see a lot of junk food coming up.
It's delicious.
Yeah. So please, you know, that's the time.
Minimizing.
After 50, people start to eat. We eat food that really is going to kill us.
Are you scared of death?
I am not. Because I'm not scared of death. I am ready anytime. But as long as I don't die in pain, as long as I don't, there are challenging situations. I've seen young adults, 2 kids, young families. I've seen these patients die. It affects me a lot. But if someone is 90, 80, 100, we really accompany them to the end of life with a lot of care.
Any parting remarks to people who still, you know, have not yet really embracing home health care, nursing homes, but specifically, let's do it about Vantage Care Limited Uganda.
Yeah, Vantage Care Uganda Limited is a new phenomenon. It's a new program that that has come to support our families and our loved ones. We are training the young people out here on 10 Chimela Close in Naguru. That's our address. And you can Google us, Vantage Care. We're on website, vantagecareuganda.com. And we also have a Facebook page. You can send your children or send your people who are looking to work. If you have a thought of going to Saudi Arabia to work, these jobs are here. I mean, these are the things they are going to do there. We want to be #1 employer of Ugandans in the next 20 years. At the same time, I think we are we want to be the #1 choice of home care services in this country. So we're more than happy to support each other. We send our girls and boys all over the country. We have clients in Kanungu, we have clients in Ntungamo, Chiruhura, Kampala. We have plenty of them. We are looking to spread all over the nation, and please don't hesitate to come and visit us, visit our social media channels, and for men of my age, 50 and above, please check your prostate. Check your prostate. It's killing most men because they never checked. And this is a preventable cancer.
Wow.
Thank you.
Thank you so much, Mr. Nkore. Thank you for the information and expounding on healthcare, home healthcare, hospice as well. It's a delicate subject and there's so much that goes in there, but yeah, and thank you for the great job that you're doing, wanting to bring something from where you work in Boston to Uganda. And I hope that we can actually embrace. So for your home health care, please reach out to Vantage, Vantage Care Limited Uganda. It says a higher standard of care, I believe so.
Yes.
Thank you so much for watching Good Morning Uganda Extra. My name is Sharon Chomdisha with Mr. Nkore Barnabas, founder of Vantage Care Limited Uganda. You can reach out to them. Their offices are at Plot 10, Chimera Road, Naguru, Kampala. You can write to them as well or check out their website at www.vantagecareug.com. Have a lovely morning. Bye-bye.
Live from UBC Studios in Kampala, this is Good Morning Uganda Extra.
The Ministry of Health informs the public that there are confirmed cases of Ebola in Uganda. We, however, urge the public not to panic as the situation is being managed. The Ministry of Health further reminds the public to be on the lookout for any persons who may show signs and symptoms of Ebola. These include high body temperature, abdominal pains, diarrhea, vomiting, bleeding from the body openings such as the nose, eyes, and mouth. Please inform the nearest health worker immediately if you see anyone with these signs and symptoms. To prevent Ebola from spreading further, please take the following preventive measures: regular washing of hands with water and soap, avoid handshaking and hugging, avoiding any contact with any suspected Ebola